Welcome to the new Queen Elizabeth University Hospital campus. Built on the grounds of the Southern General Hospital and officially opened by Queen Elizabeth in July 2015, the two brand new hospitals impress in every way. The Queen Elizabeth University Hospital is one of the largest hospitals in Europe, covering an area as big as 5 football pitches, with 7,500 rooms and 30 operating theatres. Standing 14 stories tall, it has 34 lifts. All 1,109 adult general beds are in private ensuite rooms with outside views, as are the 256 beds in the Royal Hospital for Children next door. Dependable communications ensure staff deliver faster and improved care wherever they are. For example, nurses are no longer tied to fixed stations, and allied healthcare professionals are much more mobile on the campus. Their new freedom, enabled by the use of agile mobile technology, allows them to stay in contact with patients, colleagues and patient information systems throughout their working day.
The biggest thing for me is the breakdown of barriers between me and the rest of the nursing team. The availability for me to be able to be on the end of a phone has definitely changed the way that I practice.
However, the improvements didn't just stop there. Integration of patient monitoring systems through intelligent Ascom middleware on 7 wards in the Children's Hospital means nurses can be closer to young patients, saving valuable time. This also helps reduce alarm fatigue and associated stress.
So this is a 40 single-bedded cubicle area, and there was concerns of how will we ever hear the alarms if we're at one end of this ward versus the other end. And quickly we realised that we had a central monitoring system initially, that somebody was able to look at that monitor and address if an alarm went off and then phone a nurse to say cubicle 5 is alarming. Now what happens is the alarm will phone direct to the handset. This alerting the nurses that are looking after the cubicles, and they instantly are able to respond to the cubicle. So you have completely cut down the phone call, but you've also cut down the delay.
It was clear right from the start that we needed this technology, and I feel that staff have embraced it very quickly. It's not our system, it belongs to the staff. It's how they want it to operate. To be the first with so few problems that I've known, I think that's a really good endorsement of the product.
Using the wireless phones has made me a more effective nurse, because when the alarm buzzes, it lets me know what patient it is, what room it's in and what's wrong with the patient, whether it's their heart rate or their oxygen saturations. Also, when I accept the buzzer, other nurses know that it's been accepted.
The single rooms are really good for the parents and the patients because they've got an ensuite, so they've got their own space. They're quite big rooms as well. But the parents more so felt, well, what if my child deteriorates? How's the nurses going to know? When you explain the system to them, it alleviates these fears, and they become happier that you're only a buzz or only an alarm away. It's more time effective on the whole. A&E can get me when they need me. The staff can get me when they need me. I can get the staff when I need them.
Without sounding cliché, it has completely changed our working practice.
As you have seen, there is a lot that can be done to help frontline staff to deliver better care for patients.